And as some schools open their doors, CBS News senior medical correspondent Dr. Tara Narula spoke to the health experts. They say they are even still doing their homework on this to see if current safety measures will stop the coronavirus from spreading among the kids.
He's going side to side, right, buddy?
School's in session at Idea Travis Academy Elementary in Midland, Texas, despite the state being one of the most infected in the nation. But local transmission of the virus is much lower. New COVID procedures here include temperature checks, mandatory masks, limited class sizes, and plexiglass partitions.
We have lessons on maintaining 6 feet, how to properly wash your hands, how to sanitize our table.
But the public health experts we spoke with say only some of the science behind COVID prevention is clear. Dr. Dimitri Christakis is a pediatrician and epidemiologist at Seattle Children's Hospital.
I was on a National Academy of Science task force about school reopening, and we looked at the science behind a lot of the mitigation strategies being proposed. Some of them have very strong evidence. Social distancing works, masks work. We don't know how important ventilation is. Does it have to be 6 feet? Can it be less than that? We don't know the answers to a lot of those questions.
First and foremost, kids have to be wearing masks and adults have to be wearing masks.
Experts like Dr. Ashish Jha of Harvard's Global Health Institute believe the virus can spread through respiratory droplets from coughing, sneezing, or even talking. This video, captured by slow-motion cameras, show how particles can travel when someone sneezes, both with a mask and without.
For a place like Miami-Dade County, it's going to be a lot of work because they have so much virus in their community. But for a place like New York City, it'll still be some work, but not as much because they've got the virus largely under control.
What is your advice to parents about how to make that decision about whether to send their child back to school in the area where they live?
They should rely on the public health recommendations for their local area. They should look to see what mitigation strategies their school is taking. They should take stock of their own personal situation. The decision to send your child back to school or not is a luxury that not every parent has.
Yeah, and good luck trying to get kids to socially distance, Tara, when they haven't seen their friends in a very long time. So parents are very nervous, rightfully so. What's your advice for the parents?
Every single parent I know, Gail, is asking me the same question. And really, it boils down to those things that you heard in the piece. What is the community transmission in your area? You should be aware of it. Are you in a zone where it's safe to reopen the schools? Also, you want to know, what is your school doing? So parents should feel empowered to talk to their school and find out what kinds of mitigation strategies they're putting in place. Is your child a vulnerable child? Talk to your pediatrician and see if they have any concerns about your child going back to school. And then as a parent, obviously you can do things like packing extra masks, hand sanitizer. But I think one of the important things we don't often talk about is just talking to our kids. They're going to be going back to something that isn't what they're used to. They may have their own anxieties and fears, and you really want to sit down with them and have an honest conversation in a calm, reassuring way where you listen to them and their concerns and you walk them through what to expect.
Yeah, they take their cues from you. You got to be reassuring during these times. Thank you very much, Tara.